Heart disease prevention, what you can do. Heart disease is often referred to as the silent killer, as it may ravage the cardiovascular system for months or even years before being diagnosed by a medical professional. Heart disease is the #1 cause of death in America. Over 38% of Americans had high cholesterol between 2013 and 2016. Over 1 billion people worldwide suffered from high blood pressure in 2015. Coronary artery disease affects over 18 million American adults. 1 in 3 Americans has some form of cardiovascular disease. Both heart disease and cardiovascular disease are considered broad terms used to describe medical conditions that affect the heart. The major types of heart disease include cardiomyopathy, coronary artery disease, heart arrhythmias, and heart failure. Women are more likely to be diagnosed with and die of cardiovascular disease. Coronary heart disease and heart failure are both more prevalent in men. 2 in 3 men will be diagnosed with cardiovascular disease in their lifetime, as compared to 1 in 2 women. Heart disease is considered a lifestyle disease, meaning that lifestyle choices such as diet, exercise, body weight and even sleep are factors that cause many cases of the disease. Prevention of heart disease is possible by making smart choices in self-care. One such example is clogged arteries, which can cause heart attacks, where heart arteries get clogged as a result of a poor diet, and in the worst-case scenarios, blood is blocked from being pumped to the heart, resulting in a heart attack. Reducing the risk of developing heart disease often comes down to understanding and therefore reducing the risk factors that are relevant to your life. Eat a heart-healthy diet. As important as it is to cut back on cholesterol, sodium, sugar, and fats, you also want to add heart-healthy foods to your current diet. That includes adding fiber to lower your LDL cholesterol levels and omega-3 fatty acids for lower triglycerides levels. Eat a whole food diet that includes healthy fats, lifestyle choices for prevention and management of type 2 diabetes. Experts advise that about 90% of cases of type 2 diabetes are caused by lifestyle choices, making most cases of diabetes entirely avoidable. That means you can lower your risk of developing this condition and possibly reverse a type 2 diabetes diagnosis by making some lifestyle changes. Perhaps the most significant lifestyle factor that influences your risk of developing type 2 diabetes is your diet. A key study found that a diet full of processed foods, low-quality carbs, refined grains, sugar, and sugar-filled foods greatly increase the risk of obesity and a type 2 diabetes diagnosis. On the contrary, a diet that includes plant foods, particularly whole grains, fruits, and vegetables, and low-carb healthy carb choices is linked to an overall lower risk of type 2 diabetes. Exercise can help to improve your physique and self-confidence, but perhaps the greatest benefit is the role it plays in muscle mass and weight loss. Adequate exercise is a huge lifestyle factor in an eventual type 2 diabetes diagnosis. The link between exercise and type 2 diabetes risk is well studied. One study found that aerobic training is most significant for overall health, aiding the body with insulin sensitivity, lowering the risk of heart disease, and improving blood flow.